is ERi-TV you're watching. Welcome to English News Broadcast. I'm Barsabe Tagle, and these are the major headlines for today. Effort to expand usage of smokeless ovens conducted in Agordet subzone. Soil and water conservation activity will be conducted in Haggas subzone. Overworked U.S. nurses continue strike over low pay and staffing shortages. And Burkina Faso's military leader takes over defense portfolio. On your local news, effort is being exerted in Agordet subzone to expand usage of smokeless ovens with a view to reduce electricity power consumption and preserving forest resources. Ms. Abebazer Ezgi, social development expert at the Ministry of Agriculture branch in the subzone, said that as a result of the effort to develop the understanding of the public on significance and comparative advantage of smokeless oven, over 100 families in Ngern, Aderde, and Agordet city have become beneficiaries. Ms. Abeba also called on area administrators to play due part in encouraging the public to use smokeless ovens in their household activities. The families that introduced smokeless ovens in their houses said that on top of saving wood, the smokeless oven have significant contribution in saving their health and expressed readiness to play due part in influencing other families to follow their example. Mr. Nasser Umar, acting administrator of Haggas subzone, said that sustainable soil and water conservation activities will be carried out with a view to redress the environment and develop natural resources. The popular campaign will include construction of terraces and water diversion schemes, renovation of dirt roads, as well as environmental sanitation activities. Mr. Nasser indicated that beginning from the second week of July, every day 2,200 manpower are participating in construction of terraces, and so far over 545 kilometers of terraces have been constructed. Mr. Nasser also commended the participation of government employees, members of the popular forces, as well as PFDJ organizations in the popular campaigns. According to report, greening campaign will be carried out at the hills and mountains in the subzone. Proceeding with your news, the medical facility put in place in Fildarab Health Center is significantly contributing in the effective health service provision to the public. Mr. Beilul Yamane, public health expert, said that the health center is operating with solar energy system and is contributing in easing the burden of Karen Hospital. Mr. Beilul indicated that the number of pregnant women delivering at the health center has increased by 9%, pre- and postnatal treatment and HIV checkup by 11.3%, and pregnant women visiting the health center for checkup by 97.5%. Mr. Beilul further noted that as a result of the sustainable awareness-raising activities, the number of people using impregnated nets and people suspected for malaria infections visiting the health center has significantly increased and that the prevalence has been reduced significantly. Fildarab Health Center provides health service to the villages of Fildarab, Musha, Fisruq, Farhan, Digamerat, Sanka, Jendir Diba, Ajerbeb, and Biskidira, as well as to patients from Karen and Galeb subzones. On today's last report, we have an announcement from the Ministry of Health. One patient has been diagnosed positive for COVID-19 and test is carried out today at testing station in the central region. On the other hand, 2 patients who have been receiving medical treatment in hospital in the central region have recovered fully and have been discharged from the facility. The total number of recovered patients has accordingly increased to 10,056, while the number of deaths stands at 103. The total number of confirmed cases in the country to date has increased to 10,164. Ministry of Health, Asmara, September 14, 2022. Dear viewers, and I'll be back with your international reports after the short break. Welcome back. About 15,000 nurses in the state of Minnesota began three-day strike, one of the largest of its kind in the U.S. history, as they push for higher pay and better staffing in a healthcare system that has been overstretched due to COVID-19 pandemic. The strike began on Monday in 7 healthcare systems in Minneapolis and Duluth, with nurses mounting picket lines, chanting slogans, and holding signs bearing messages such as "Patients before profits." The strike highlights the persistent problems that U.S. healthcare workers face, such as low pay and staffing shortages. The pandemic has exacerbated many of those issues, and the health sector has lost about 37,000 workers since February 2020, and this is according to the U.S. Bureau of Labor Statistics. On today's last report, a statement read on Monday on Burkina Faso's national television said that Burkina Faso's military leader, Colonel Paul Henry Damiba, has taken over the defense portfolio in the West African nation, struggling with an ongoing Islamist insurgency. The statement did not give reasons for the cabinet reshuffle. Damiba seized power in January, citing the previous government's inability to tackle the country's problems, including the insurgency that has killed thousands and displaced more than 2 million, including in neighboring Mali and Niger. Attacks by militants linked to Islamic State and Al-Qaeda have in fact continued unabated since the coup. You're still watching ERi-TV, dear viewers, and now a recap of today's major headlines. Effort to expand usage of smokeless ovens conducted in Aurde subzone. Soil and water conservation activities conducted in Hagga subzone. Overworked U.S. nurses continue strike over low pay and staffing shortages. And Burkina Faso's military leader takes over defense portfolio. Dear viewers, that was all for today. Thanks for watching and have a good one.